Hello, everyone. We'll be getting started in just a few moments. Good morning, everyone. Yeah. This is the pre-applicant webinar for the Behavioral Health and Community Safety Partnerships, BH-CSP, Notice of Funding Opportunity SM 26-023. On today, June 18th, 2026. Your hosts today are Commander Katie Hager, the branch chief for the Disaster Division in Disaster Behavioral Health within the Division of Trauma and Disaster Behavioral Health. With me today is Ms. Jessica Leopold, the Public Health Advisor, and Ms. Eileen Bermudez with Division of Grants Management, Division of Grants. So our agenda for today is a welcome and introductions, funding details, the program purpose, key personnel, required and allowable activities, eligibility, data collection, performance measurement, and performance assessment, requirements, application content, and format. The estimated total available funding for this grant program is $9,200,000. The anticipated number of awards is 12. The estimated award amount is up to $750,000 per year. The length of the project period is up to 5 years. The application deadline is July 13th, 2026, with an expected award date September 1st, 2026. And the expected start date is September 30th, 2026. Your annual budgets cannot be more than $750,000 in total costs, direct and indirect, in any year of the project. Annual continuation awards are dependent on the availability of funds, progress in meeting project goals and objectives, timely submission of required data and reports, and compliance with all terms and conditions of the award, and alignment with SAMHSA, HHS, and administration priorities. Applications must also align with SAMHSA's strategic priorities. Proposed budgets must include costs that are allowable, reasonable, and allocable.
The purpose of the Behavioral Health and Community Safety Partnerships is to support communities in reducing the behavioral health impacts of crime, violence, and disorder, strengthening community safety, and improving outcomes for youth, families, and other individuals affected by crime, violence, and disorder. This program is designed to address these challenges through a comprehensive, community-based approach that emphasizes prevention, early intervention, evidence-based care, and system coordination. Through these efforts, the program supports both individual recovery and community-level prevention and resilience, while contributing to broader goals of reducing the impacts of crime, violence, and disorder, and improving behavioral health outcomes for individuals and families. The key personnel for this project, there are two. The project director must oversee the grant to ensure goals are met, all reports are filed on time, and all rules are followed. This position requires 100% level of effort of a full-time equivalent position and should be filled by one individual. The project coordinator must be a member of the community in which the grant project takes place and manages the day-to-day work with stakeholders and local organizations. This position requires a minimum level effort of 50% full-time equivalent and should be filled by one individual. The required activities for this project are as follows. Establish and maintain a behavioral health and community safety coalition. Establish memorandums of understanding. Conduct a community needs and resources assessment. Develop and implement a community strategic plan. Implement community-based behavioral health and prevention services. Strengthen community-based post-trauma response and behavioral health capacity. Strengthen workforce capacity across systems, and strengthen community capacity to engage youth and families. Allowable activities are not required. However, your organization may propose to use funds for the following activities. Provide mental health literacy training for community members, community serving providers, and stakeholders. For example, first responders, school personnel, clergy, and faith-based entity staff, parents, caregivers, health and human services providers. Provide training for law enforcement that focuses on increasing effective police-community relationships. Develop additional intervention products, for example, protocols, manuals, training materials, screening tools, to fill identified needs so that effective treatment, practice, and service approaches can be replicated and disseminated to an array of community and service system providers across the country. And this is a continuation of allowable activities. Consider the communities that will be affected by this project and engage them in the overall program planning. To do so, SAMHSA encourages applicants to engage communities when practical during the design phase and develop programs in consultation with communities benefiting from or impacted by the program.
Eligibility. Applicants are domestic public entities and private nonprofit entities, including states, territories, political subdivisions of states, tribes or tribal organizations, health facilities, programs operated by or in accordance with a contract or award with the Indian Health Service, public and private nonprofit organizations. Please note, if you are a nonprofit organization, you must provide documentation of your nonprofit status in attachment 8 of your application. You must collect and report data and document your plan for data collection and reporting in Section B of your project narrative. Discretionary awards should include clear benchmarks for measuring success and progress towards relevant goals. The recipient is required to submit programmatic progress reports that demonstrate whether you are meeting the objectives you selected for this project and achieving the outcomes you anticipated, and whether any changes need to be made. You must review your performance data to find out if you are making progress and improving project management. Additionally, you must collect and report selected indicators on a quarterly basis. The data collection instrument, OMB approved reporting tools, and related guidance will be provided post-award. Please note this grant will not collect client-level data. You must collect and report data on measures related to the number of individuals contacted through program outreach efforts, the number of individuals who receive mental health services, the number of individuals who receive support for recovery and resilience, and the number of individuals trained on trauma-informed care. You will receive training and technical assistance on SPARS after award. The data you collect allows SAMHSA to report on key outcome measures. Performance data may be reported to the public. The project abstract should be 1 page or less and must include the project name, the geographic area that will be reached through the grant, and the capacity development need in the geographic area, the population of focus that will benefit from the capacity building, a description of the population plan to be served, strategic and interventions to increase capacity, project goals, and measurable objectives. In the first 5 or fewer lines of your abstract, write a summary of your project that can be used in publications, reports to Congress, and press releases if funded. Please note, this program was formerly known as RECAST. If you have previously received RECAST funding, if you have previously not received RECAST funding, you are eligible to receive an additional 5 priority points, up to a total of 30 points for Section A. Please note, if you previously received a RECAST grant, you cannot receive the 5 priority points and will only receive a maximum of 25 points for this section. The following instructions should be considered as you develop your project narrative. The project narrative cannot be longer than 10 pages. There are 4 sections, sections A through D, and you must use the section letters, numbers, and headings listed in the evaluation criteria. Include the section letter and number, for example, A.1, B.2, before the response for each criterion. You do not need to type the full criterion in each section. Do not combine two or more criteria or refer to another section of the project narrative in your response. Reviewers will only consider information included in the appropriate numbered criterion. The number of points after each section's heading is the maximum number of points a reviewer may give for that section.
Application submission. Applications are due Monday, July 13th, 2026. Applicants are required to have active registrations in SAM.gov, grants.gov, and ERA Commons. If you have already completed registration for SAM.gov and grants.gov, you need to ensure that your accounts are still active and then register in ERA Commons. SAM.gov registration can take several weeks. Begin that process today. When your application is submitted, it must pass validation checks for both grants.gov and ERA. You will receive emails from both systems to either confirm the application successfully passed validation checks or to notify you that there were errors that must be fixed before the application can be considered successfully submitted. If using the grants.gov workspace tool, use the preview grantor validation feature in grants.gov before submitting your application. Doing so will allow you to validate your application and review, fix all errors and warnings before submitting. It is strongly advised that organizations log into their ERA Commons account post-submission to confirm submission status, as emails from each system could be placed in a recipient's junk mail folder and go unread. The registration process can take up to 6 weeks. Grants.gov will reject electronic submissions from applicants with expired SAM registrations. It is strongly advised that organizations log into their ERA Commons account post-submission to confirm submission status. And now we will transition to Eileen Bermudez, Supervisory Lead with the Division of Grants Management.
Good morning, and thanks again for participating in this pre-application webinar. I will be presenting the grants management overview of your application requirements. The information you will find here will be helpful as you're working through the application, so you should keep it handy as a point of reference. Objectives that we will be discussing: application guide, application policies and regulations, factors affecting allowability of cost, budget narrative and justification, sample budget template, SF424A, key personnel, indirect cost rate, funding limitations and restrictions, and any technical support available. We included the application package link which can be found embedded within the current notice of funding opportunity that we like to call the NOFO. Please review the application guide as it includes helpful and pertinent information related to this NOFO and the application process. It's extremely important to read through the guide in its entirety. The resources on this slide will assist you with the regulations and policies applicable to SAMHSA grants. Many policies have been updated, including the HHS grants policy, the 2 CFR 200, the executive orders, and SAMHSA's priorities. Please ensure your grant application aligns with all policies and regulations noted in the NOFO. Ensure that you thoroughly read the NOFO for specific requirements. Factors affecting allowability of costs. Please keep in mind that your proposed budget must contain only allowable, reasonable, and allocable costs as defined under the 2 CFR 200, 403, 404, and 405. Estimated award amounts. Katie kind of went over this, but I'll repeat it. Annual funding limits up to $750,000 per year includes total cost, direct and indirect. And for continuation funding, you must assure that annual awards are subject to availability of funds, progress towards project goals and objectives, timely submission and required data and reports, compliance with all terms and conditions, alignment with SAMHSA, HHS, and administration priorities. On this slide, we have included links to the budget template created by SAMHSA. It is highly recommended that you use SAMHSA's PDF budget template to complete the detailed budget and narrative justification required for the submission of your application. SAMHSA's budget template includes a wealth of helpful tooltips and resources to assist and guide you with the preparation of your budget. The budget template was created with extensive grant recipient consultation and input and designed to avoid all common budget preparation pitfalls. Use of the SAMHSA's template will reduce errors and could delay review of your budget by SAMHSA. All applications must include a detailed budget with narrative justification that explains the federal and non-federal expenditures. Your budget must be consistent with and support the project narrative. The budget narrative and justification must be concrete and specific. It must provide a justification for the basis of each proposed cost in the budget and how that cost was calculated or determined. Detailed breakdowns must be provided to facilitate the determination of whether the costs proposed are allowable, reasonable, or allocable. Avoiding common issues with the SF 424A. These budget errors are listed for your reference, but they're much easier to understand with the visual aid. So here's a copy of a 424A for a program that does not require match. In section A, budget summary, row 1, input the NOFO number in column A, identified as grant program function or activity. And in column B, enter the federal assistance listing number as shown in the NOFO. In section A, budget summary, row 1, enter the total federal request in the subsection new or revised budget, federal, column E. This will populate the amount down to row 5, the totals row. In section B, budget categories, use column 1 in the grant program function or activity subsection to break your costs down by the object class categories. Note that the cells required in green must match up. The validation here is to make sure that your total entered in section A matches the total of the cost in section B broken down by category. In addition, the budget category totals from the detailed budget narrative justification must correspond to each of the object class categories in section B of the 424A. Since this example does not require matching funds in section C, if you have any in-kind contribution, you would reflect it in this section. Section D is where you break down your forecasted needs by quarter. You will need to take the total you entered in section A and then break down your cash needs into 4 quarters. Section E is for future funding periods. Note that column B, or the first column, is for the first future year funding period, which is essentially your second budget period. Similarly, column C would be the third budget period, and so on. Section F is for other budget information and is optional. Key personnel, as we mentioned a little earlier, for this project, the project director has to have a level of 100%, and the project coordinator of at least 50%. Both key personnel positions must be listed in your detailed budget, even if no federal funds are being requested for these positions, if they're in kind. The individual that you identify as the project director for the grant must have the principal investigator or PI role in ERA. Only one individual with the principal investigator PI role can be designated as contact to take actions and receive notifications in ERA. If the PD position is filled by a contractor or a consultant, please include a copy of the agreement in your application that specifies the official relationship and addresses performance of all the required duties and responsibilities. Indirect cost rate agreement or cost allocation plan. Please ensure that you include your organization's current negotiated indirect cost rate agreement or cost allocation plan in your application package. If your organization is opting to use the de minimis rate of 15% of modified total direct costs, then a clear statement must be made to that effect in your IDC narrative of the detailed budget. Funding limitations and restrictions. Please refer to the NOFO. There are several funding limitations and restrictions for this project. Some may include food as an unallowable expense. Capital infrastructure such as computer systems, softwares are recoverable as depreciation through an approved negotiated indirect cost rate or 15% de minimis rate in accordance with your organization's existing capitalization amortization policies. Funds may not support racial preferences or discrimination, policies denying the biological sex binary, illegal immigration activities, activities that comprise public safety or conflict with federal priorities, harm reduction, as outlined in SAMHSA's Dear Colleague letter, nor can funds be used for housing first policies that fail to ensure accountability and fail to promote treatment, recovery, and self-sufficiency. You must also comply with SAMHSA's financial management standards and funding restrictions found in Section G of the application guide and adhere to applicable federal anti-discrimination laws. And these are the contacts of the SAMHSA staff that you can contact if you have any additional questions on how to submit your application.
Thank you again for your attendance. As a reminder, this webinar will be posted to the SAMHSA YouTube channel, and a link will be emailed to you when it becomes available. We will leave the slide up with the points of contact for just another few moments before we end today's call. And we'll provide the email address to send the questions that are in the chat.